Riluzole is a medication that is used to treat a type of nerve disease called amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease. It helps to slow down the progression of the disease and increase the lifespan of patients. The recommended daily dosage of Riluzole is typically 50 mg, taken orally twice a day. It is important to take the medication at the same times each day for the best results. Before you start taking Riluzole, make sure to read the patient information leaflet and instructions for use if available. Take this medication by mouth on an empty stomach, as directed by your doctor, usually twice daily. If you are using the liquid form, shake the bottle for at least 30 seconds before use and measure the dose carefully. Use this medication regularly at the same times each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. And if your condition gets worse, be sure to tell your doctor. You may experience dizziness, drowsiness, nausea, vomiting, or numbness/tingling around the mouth. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects, such as a fast heartbeat, signs of liver disease, signs of infection, or signs of lung problems. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. As always, it's important to consult your healthcare provider for any concerns or questions about your medication. Before taking Riluzole, make sure to inform your doctor if you have any allergies or if you have a history of liver disease. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. If you use liquid products, be cautious if you have diabetes or phenylketonuria, and consult your doctor before using them. Inform your doctor about all the medications and herbal products you use before having surgery. If you are pregnant, use this medication only if necessary and discuss the risks and benefits with your doctor. It is unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. As always, talk to your doctor or pharmacist for more information about using Riluzole safely. It's important to be aware of potential drug interactions with Riluzole, as they could affect how the medication works or increase the risk of serious side effects. Remember to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Riluzole. If someone has taken too much Riluzole and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911. Otherwise, you can also contact a poison control center for guidance. In the US, residents can call 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include mental or mood changes, such as confusion and memory loss, as well as severe drowsiness. Riluzole is used to treat a certain type of nerve disease called amyotrophic lateral sclerosis, ALS. It helps to slow down the progression of the disease and prolong survival. The usual dosage for Riluzole is 1 tablet taken twice a day, at least 1 hour before or 2 hours after a meal. It's important to take it consistently at the same times each day. This medication is best taken on an empty stomach to maximize its effectiveness. It's important not to share your Riluzole medication with others. Before starting and while taking this medication, you should have lab and/or medical tests, such as liver function tests. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose of Riluzole, take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. As for the best time to take Riluzole, it's recommended to follow your healthcare provider's instructions for the optimal timing. When taking Riluzole, it is important to store it at room temperature, away from light and moisture. If you are using the liquid form, make sure to store the bottle upright and keep it tightly closed. Do not freeze the medication and use or discard it within 15 days after opening. Always keep all medications away from children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when the medication is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.